Hey, I suffer from back acne and it's pretty disgusting. I hardly break out on my face, but when I do, it goes away within a day. But my back is home to thousands of tiny acnes. Can you suggest various procedures I can take to clear up my acne?
For great skin, technique matters.
Okay, so it's basically called body acne when you have acne on your back and maybe a few other places. Some people get it on their chest. And for body acne, it's a combination of technique. So technique and obviously the products that you're using and maybe lifestyle. So there are a few things you can do, starting by making sure that when you shower properly. So yes, use a sponge. However, most people's hands don't get to all parts of their body. A lot of us focus on our arms and we're scrubbing, and we do maybe our legs. But we forget to make our hands reach there. And if it can't reach all the way down, you have to like put your hand back there with your hand gloves, or your sponge. And do it in a circular motion. That way you're exfoliating the skin and at least your pores are open and ready to take on what you put next on it. So if you're not exfoliating properly your back and maybe like your chest area and you're forgetting to do that all the time, you are going to have problems. So it's probably a build up of excess skin cells that have not been exfoliated properly. Two, what is your body lotion? So if you're somebody who sweats a lot, if you're somebody who plays sports a lot, or you go to the gym a lot or something like that, or your hair is constantly back there, so, and then you're not scrubbing properly at the same time, so you have a build-up of things and that can cause acne as well. So you need to make sure that the products that you do use on your body are products that have exfoliating ingredients, and stay clear of things like Vaseline and too much oil, at least while you're suffering this problem and you're trying to deal with your body acne. You want to use things that have fruit acids, which are AHAs, BHAs, namely salicylic, lactic, or glycolic acid. So it has a combination of these. So you would want to read the ingredients or just ask someone, seek professional help and ask someone. So technique, the right ingredient, you want to make sure that your body lotion is not too creamy. A lot of people say, oh, I just use shea butter. And then you wonder why you have all this body acne. There's nothing wrong with shea butter, but even when I'm using shea butter, there's some areas where I would not use it, namely my face, because I don't want my pores to be clogged. So if you're already having pimples and acne on your chest and on your back, you shouldn't use anything that's going to clog your pores. And then technique and cream, that's it for me, and wear like loose clothing. So that should help.
So I have a layman question, but I'll come back to that after Dr. Awudu, you give us your...
Okay, so I think she's absolutely spot on with her directives as to how you manage it from a simple... I think it's certainly one of the problems that I think you should see a doctor about.
Okay.
Why? Because there are various degrees of it. You can have it in a mild form, moderate, severe, into what we call cystic acne. So really big cysts that lead to scarring. So I think it's certainly something you should see a doctor about to diagnose it right, because there are other things, so many other things lead to why you have it. Certainly it's a problem of excess sebum production, excess oil production, testosterone, hormones generally, even down to, studies have shown that even milk can trigger it off, the hormones in cow's milk. So let somebody diagnose it properly, find out what the possible underlying cause is, and let's address that. In direct relation to the acne itself and how we manage it depends on how severe it is. Simple measures like how
like exfoliating,
Ms. Okoye has described is absolutely right. Loose clothing so that skin breathes, avoidance of thick moisturizers. You want water-based moisturizers, acids to help exfoliate the skin. But sometimes that's just not enough. Then you move on to the next level where you're using products, over-the-counter products like benzoyl peroxide. That helps with inflammation, helps with the bacteria that feeds off the oil that leads to the cystic acne, that leads to the inflammatory pus that we get and all those things we're squeezing out and all that. And then up to quite often, to really get back acne, if it's bad, you might need to go onto oral antibiotics for a period of time, which kill the bacteria that feed off the oils that cause all the inflammation. And there are quite a few people that have to go on to the next level where we're talking about medications like Roaccutane. So I think it's something it can be disfigurating, it can affect people's self-esteem. So seeing the right professional, diagnose it correctly and get it properly treated. There are usually modalities now, including lasers, certain types of lasers to treat acne, but not on its own. Quite often you'll find with acne you need an adjunct of things, so even down to chemical peels. So, once you've controlled the inflammatory spots, then even come to peels, because another problem that faces our skin with acne is the pigmentation. That you'd be amazed how not just the spots, it's the acne itself, but the after effect of the acne, one of which is excess pigmentation, hyperpigmentation, and how that can also affect people's self-esteem.
So layman question.
Yeah.
With these techniques that you mentioned, especially the skincare techniques, like the
Scrubbing, the way you wash your body,
like how you do it. So the products and how you use them. If somebody that's had acne for a very long time, how long would it take to clear?
Well, as you said, it depends if you're seeking a professional. Okay, from majority of the patients that come to see me, majority of people that walk into my office and say, oh, I want cookie skin, I want you to recommend, or I'm just coming in for a consultation because I think my case is bad, come and recommend.
Yeah.
When it comes to body acne, if you don't have acne on your face at the same time as acne on your body, then the case, in my opinion, is not that serious.
Okay.
It's usually blocked pores, bad hygiene, bad technique in your hygiene, and it can easily be cured with scrubbing the right way, using the hand gloves, which I always recommend, nothing too heavy, hand gloves. Make sure you get to that back area, don't miss any spots, and then using the right kind of creams. So I would recommend Cookie Skin because it has everything, so that you're not picking one. So it has AHAs, BHAs, and then things that help with acne. So people actually started emailing me to say, oh my God, it really helped with my acne, even if it didn't brighten me as much as I wanted it to brighten me.
It helps with that.
So that's when I started understanding that, wow, people are dealing with many kind of issues. But most of the cases with body acne I have seen are not as severe. The chest one, however, I find it's usually hormonal. So a lot of times I do tell people, as he said, to remove milk from their diet, try and do a bit of elimination. Milk,
and see what?
Nuts. I'm not saying don't eat, I'm just saying eliminate those things, because bad bacteria in your gut breaks out through your skin. So if you're not feeding yourself healthy bacteria that comes from things like yogurt, fruits and vegetables, you would always be battling an acne problem.
Okay, layman question number 2. So we see a lot of products advertised everywhere, even from people that will, claim they're professional. Like, I remember there was a time I was watching the Tara Banks show, and she's like, I'm going to tell you guys my skincare secret. She's shouting, screaming, falling on the floor, hallelujah. And then she says it's Vaseline. And I now go and I rub Vaseline all over my body and I start breaking out. And I'm just like, if I see this woman, So, there's different things. There's like biotin that they claim is really good. There's so many things over the counter that they say you can just walk into a store and buy, it'll clear your acne, etc. And I have bought products. A lot of products.
I know you have.
Exactly. So I just want to ask, is there like a laser or something that you can do to just fire each?
I can't overemphasize the importance of seeing somebody for a consultation.
Is there a laser?
Because exactly what you just described.
Yeah. Just going and buying stuff.
There are lasers that can
but there
help.
Are many
but
lasers,
but
so you
like I said,
need the
you need. You could. A lot of what's out there is marketing gimmick.
True.
Absolutely,
Some of them work though.
No doubt about it, but it's such a mucky water
to
pick out what works, and because no two individuals are the same.
True.
No two individuals are the same. So what works for you?
Okay.
Vaseline, amazing for some people, especially if they've got certain types of dry skin. Certainly not for someone who's got oily skin and you're trying to clear out the pores and you're going to go clog it up some more. So invest in, first, the most important thing you can do is sit with a professional. That 15-20 minutes can save you tons of money.
Very true.
Tons of money, rather than go trying to sort it out yourself.
I agree.
It's a maze out there. It's a maze.
Do your research. I have to totally agree with him on this, because even if you're saying, is there some kind of laser? That's what people say. There's something I can drink. There's nothing you can
There's
drink.
no one thing.
Somebody told me there's tablets you can just take and it'll clear off all the dark.
It's a combination of things, and I'm going to explain it to all of you very simply. So you want to do your hair, and you go to the salon to do your hair. You're going to wash your hair with shampoo, and nobody leaves just after washing your hair. You use conditioner. And after you've done the conditioner,
You
you're
dry.
gonna towel dry your hair. And some of us do leave-in treatments, then we blow out, then we oil our scalp with something else, then we put heat resistance before you blow dry the hair. So if you take care of your hair by using a minimum of 4 products, why do you think your skin will only just need one thing?
It's true. That is true. Guys, we have to take a break now, but we will be back to take our last question. Don't forget that you can leave your comments online. This is a very, very, very insightful episode, so I can't wait to come back from the break. Don't go anywhere.